So Martha, what was your question?
I was going to ask that if once you're on CBD oil, do you continue taking the CBD oil, like say for life or whatever? Is that like any other medication? Once you start, you have to continue being on it?
No, actually, medications should only be periodic for the issue or the injury or the illness at hand. As you've experienced from this group, some of you may have been on diabetic medications and you've gotten off them as your condition improved. Same thing with CBD. As your condition improves, you should need less of it. And specifically, as you work more on the primary underlying causes of inflammation, and that's what Christopher keeps on talking about over and over again, is diet, foods that you eat help to reduce the inflammation environment in your body, along with exercise that also helps out with reducing that inflammatory response. So hopefully it's just temporary.
Okay. Thank you.
You're welcome.
Now, Dr. Phillip, you talked about when a person first starts with the CBD oil, that they start off with a smaller dosage and then they build themselves up. Is that correct?
Yeah, so the whole idea is to start low and go slow. We talked a little bit about this last time. Usually most people start off at somewhere between 1 milligram to 5 milligrams per kilo. A kilo is about 2.2 pounds. So that means that on average for 100 pounds, that's about 50 milligrams that you would start off with. If you're starting off at the low end of the 1 milligram, if you're starting off at the high end, then you're looking at 250 milligrams. But most people start off at the low end at about 50 milligrams. And you can either split that up or you can take it all at once.
Okay, so leading into part B of my question was, because you start off slow and then build yourself up, when you take yourself off, as you said that you should cycle it, do you have to wean yourself off, or can you just stop on instantly with that? Is there any side effects, any withdrawal symptoms you may have?
No, there's no withdrawal. And you don't necessarily need to taper. You could just stop when you're feeling well. But just make sure that you have everything else in place too. In other words, if you're looking at inflammatory markers, which your group measures, make sure that all your inflammatory markers are in alignment and optimal before you consider going off or stopping.
And for the people that want to test their inflammatory markers, besides CPR and homocysteine, are there any other markers that you would recommend for them to test?
So the easiest ones, and the one that you won't get a lot of pushback from mainstream medicine physicians, are something like A1C, LDL, triglycerides, possibly HDL, and then liver function tests. So those are the easy ones that I don't think anyone is going to push back and say, why are you getting this test?